Welcome to the Advanced Tool Health and Life Coach Certification. Today we're going to be discussing mind optimization coaching modules, more specifically about biohacking for cognitive enhancement. Introduction. Biohacking is the art and science of optimizing the body and mind through strategic interventions, has gained significant traction in the recent years. While the term might evoke images of extreme measures, biohacking is simply about leveraging evidence-based methods to elevate physical and mental performance. For life and health coaches, understanding biohacking isn't just a trendy pursuit, it's a crucial tool to help the clients unlock their mental potential. Key points 1. The science of cognitive optimization. Understanding cognitive enhancements. Cognitive optimization improves brain functions like memory, attention, decision making, and mood regulation. Core factors contributing to cognitive health spaces include neurotransmitter balance. Things like dopamine, serotonin, and acetylcholine need support for optimal brain communication. Mitochondrial function. Brain cells rely on healthy mitochondria to generate sustainable energy, reducing mental fatigue. Neuroplasticity. Enhancing the brain's ability to rewire and adapt increases resilience to stress and learning capacity. Why biohacking works. Targeting neurophysiology. Interventions such as nootropics boost neural efficiency, increasing brain-derived neurotropic factors, which is BDNF, which encourages the growth of new neural connections critical for learning and adaptability. Limiting oxidative stress. Things like fasting reduce inflammation, a major cause of cognitive decline. Example, a biohacking person leveraging fasting can reduce insulin spikes, improving mitochondrial performance and focus. Let's move on. Point number 2 is advanced tools for biohacking cognitive performance. Nootropics. These are smart drugs and natural enhancers. They improve cognitive abilities from focus and creativity to mental clarity. They can be classified into pharmaceutical nootropics. Drugs like modafinil and piracetam enhances memory and focus but requires supervised use. Natural nootropics, herbal compounds such as ginkgo biloba, ashwagandha, bacopa support mental energy and reduce anxiety. Synthetic nootropics, lab-created supplements like alpha-GPC and huperzine A increases acetylcholine production for better memory and learning. Key example, L-theanine, when paired with caffeine, delivers enhanced focus without jittery effects of the caffeine alone. Important notes for coaches. Always advise the clients to consult with a healthcare provider before starting pharmaceutical or synthetic nootropics. Begin with natural alternatives for safety and gradual improvement. B. Intermittent fasting. Intermittent fasting incorporates specific time windows for eating and fasting to reset the metabolic and cognitive systems. Impact on the brain. Intermittent fasting reduces oxidative stress, increases BDNF, and encourages autophagy. These sharpen focus and protect against cognitive aging. Popular fasting protocols 16/8 for daily cognitive efficiency. 5/2 approach, which is 5 days normal eating, 2 days calorie restriction to promote neural adaptability. Case study example. An entrepreneur struggling with decision fatigue found that adopting 16/8 intermittent fasting improved both the energy and afternoon productivity. C. Red light therapy. Also known as photobiomodulation, red light therapy penetrates the skin to stimulate mitochondria in the brain cells. Benefits are increased ATP production, improving cellular energy, reducing oxidative stress in brain tissues, and improve mood and cognitive endurance. To use it safely, use quality control devices designed specifically for cognitive treatments and limit sessions to 10 to 20 minutes. D. Deep sleep optimization as a cognitive hack. No biohacking discussion is complete without emphasizing sleep. Sleep impacts every aspect of cognitive functioning, from memory consolidation to emotional stability. Tools for sleeping as a biohacking aspect. Blue light blocking glasses prevent melatonin disruption during evening hours. Wearables like the Aura rings track sleep patterns to pinpoint efficiencies. Enhancing deep sleep. Magnesium glycinate before bedtime can improve restorative sleep cycles, directly influencing the mental focus the next day. 3. Practical biohacking guidelines for clients. Initial considerations. Safety first, to ensure that the interventions are non-invasive, evidence-based, and appropriate for the client's health status. Track the metrics. Begin biohacking with measurable goals like improved concentration during work meetings or better memory retention. Steps for integrating biohacks. 1. Educate clients on small changes. Example, introduce nootropics as part of the morning productivity routine. 2. Pair advanced tools like IF with the nootropic protocol to avoid mental energy dips after meals. 3. Evaluate the responses and adjust. For instance, red light therapy might work better in the morning for clients with restless sleep patterns. Coaching applications. Boosting focus and mental clarity. Combine L-theanine with caffeine as a morning stacking protocol. Pair 16/8 fasting cycles with client workloads to enhance clarity during demanding tasks. Stress and mood management. Utilize natural nootropics like ashwagandha for anxious clients and encourage evening red light therapy to offset the cortisol spikes after stressful days. Strengthening the memory and learning. Incorporate nootropics that boost acetylcholine such as alpha GPC. Coach memory enhancing practices like spaced repetition alongside these tools. Combating cognitive fatigue. Rotate fasting protocols during seasons of high stress and introduce daily cold showers or breath work to stimulate mental alertness. 4. Ethical boundaries in biohacking. Do no harm. Always prioritize the safety of tools over performance optimization. Transparency. Educate the clients about potential risks, especially pharmaceutical nootropics. Personalization over trends. Avoid generic protocols and make sure that it is tailored to individuals' health and goals. Best judge of the chorus. Biohacking cognitive enhancement is about harmonizing your client's brain processes while leveraging the tools and strategies uniquely suited to their lifestyle and needs. Coaches are the orchestras of the intricate harmony, balancing advanced science and client-centric personalization. Understanding the client's needs. Whether addressing a student struggling to focus or a professional dealing with brain fog, begin with a detailed assessment to tailor the protocols effectively. Integrating multi-layer tools strategically. Combine nootropics with structured meal plans to limit blood sugar-induced cognitive crashes. Introduce red light therapy as a routine evening practice to stabilize mood and mitigate fatigue. Evaluating client progress dynamically. Utilize sleep trackers, food diaries, or cognitive performance tests to measure the long-term progress. Clients practicing intermittent fasting or red light therapy should receive clear feedback on outcomes like mood stability, endurance, or sharper memory. Ensuring safety and balance. Biohacking should enhance and not overstretch the natural resilience threshold. Avoid over-relying on stimulants or aggressive fasting for unsustainable gains. Educating on ethical use of advanced tools. For clients considering nootropics, full healthcare provider consultations are non-negotiable safety measure. Highlight the long-term mental optimization using sustainable routines over short bursts of overclocked enhancements. Closing thoughts. Biohacking for cognitive enhancement is a blend of science, technology, and lifestyle interventions to optimize mental performance. It has advanced tools like nootropics, IF, and red light therapy to help the clients achieve improvements in focus, memory, and resilience. The essence of biohacking relies on thoughtful experimentations in alignment with long-term health. These approaches can yield substantial benefits, but a coach's role is to ensure that the clients adopt them safely, incrementally, and effectively. By combining innovation with responsibility, you can empower your clients to unlock their highest cognitive potential and elevate their ability to thrive emotionally, mentally, and cognitively. Let's look at some summary tables. Table number 1 looks at the core biohacking tools and their cognitive benefits. Let's have a look at IF as one of the biohacking tools. Primary cognitive target is mental clarity and resilience. Mechanism of action: reduces oxidative stress, promotes BDNF production. Example: 16/8 fasting schedule. Potential benefits: it enhances mood and sharper focus. Table number 2 looks at nootropics and their specific use cases. Let's have a look at one of the examples, which is a pharmaceutical type of nootropic. Ingredient could be a modafinil tablet, and cognitive impact is wakefulness and high focus. It is recommended in professionals in high-intensity jobs, and safety notice it has to be supervised use only by medical experts. Table number 3 looks at benefits and considerations of intermittent fasting. Let's have a look at time-restricted eating for one of the fasting protocols. Window example could be meals within 10-hour windows. Role in cognitive enhancement is that it maintains a metabolic health for work-life balance. Ideal client profiles could be general beginners. Possible drawbacks is that there is limited data for extreme cognitive enhancement. Table number 4 looks at practical coaching applications of red light therapy. Let's have a look at the midbrain or the limbic area as one of the brain area impacted. Mechanism of action is that it reduces oxidative damage. Recommended usage time is 15 minutes late in the evening. Ideal client situations is clients recovering from emotional burnout. Expected outcome is that it stabilizes the mood and reduces your stress levels. Table number 5 looks at the comprehensive client biohacking plans. Let's have a look at one of the examples, which is the creative freelancer. Main cognitive challenge is energy dips impacting the outcome. Primary techniques for biohacking would be L-theanine and some caffeine stack. Practical examples would be structured small focus boost doses pre-workout or pre-project, and expected outcome is long-lasting productivity and reduced jitters. Let's have a look at some MCQ questions. Take a moment to have a look at question number 1 and 2 without looking at the actual answer. Take a moment to have a look at question number 3 and 4. And finally, question number 5. Thank you.